On behalf of the Centers for Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is David Saltzman, and I work for Kaufman & Associates. I'll be your moderator today. Today's webinar is COVID-19 in Indian Country, Updated Considerations and Resources for Long-Term Support Services. Before we begin, I would like to highlight the main features of your Zoom webinar interface. Next slide, please. First, the presentation slides will appear in the main window, while the speaker will appear in the top corner. At the bottom of the screen is the menu bar. Here you'll find the chat, raise hand, Q&A, and closed caption functions. Please use the chat box to report any technical issues you are experiencing. We will respond to these concerns as they come in. Next to the chat box is the raise hand feature. You're able to use this during the Q&A segment to let us know when you'd like us to unmute your mic so you can ask a question. Another way you're able to submit a question is the Q&A box itself, where you can leave your questions at any point during the webinar for the presenters to address during the Q&A segment at the end. Lastly, live captioning is available for today's broadcast. Simply click the CC icon to use this feature. Please be aware that today's webinar is being recorded and that the recording will be made available in the near future on cms.gov. With that said, I would like to welcome everybody to today's webinar. Next slide, please. Please note, this webinar series is supported by a contract awarded by the Centers for Medicare and Medicaid Services. The opinions, findings, conclusions, and recommendations expressed in this webinar are those of the presenter and do not necessarily represent the official position or policies of the Department of Health and Human Services or the Centers for Medicare and Medicaid Services. Next slide, please. I would like to introduce our presenter, Crystal Tetrick. Ms. Tetrick is Vice President for Health Systems and Policy at Kaufman & Associates and a subject matter expert on COVID-19 and LTSS. Please go ahead.
Hello, everyone, and thank you for joining us today. The last time I presented on COVID-19 in Indian Country was back in April 2020, just as COVID was surging and most communities were isolating with businesses and schools closing. Today, I will discuss COVID-19's impact on American Indian Alaska Natives and the most current COVID-19 guidelines for long-term support services providers working in tribal nursing home and long-term support facilities. We recognize this information is changing frequently and it isn't always easy to find resources and guidance easily. So we're hoping that today's presentation will help consolidate some resources that are helpful for LTSS providers. COVID-19 or coronavirus 2019 is a disease caused by a virus named SARS-CoV and was discovered in December of 2019. That's also why it's considered a novel virus. Older people and those who have certain underlying medical conditions are more likely to get severely ill from COVID-19. Vaccines against COVID-19 are safe and effective, as research has shown. And on February 18th, Indian Country Today unfortunately reported that the US had almost 1 million deaths directly or indirectly attributed to COVID-19. The Centers for Disease Control and Prevention confirmed in February that more than 10,000 American Indians and Alaska Natives have died from COVID-19. And the states of Arizona, California, New Mexico, and Oklahoma had the highest death rates for COVID-19. They are also the states with the largest populations of American Indians, Alaska Natives. The late Cherokee chairwoman, Wilma Mankiller, once said that Indian people work best with Indian people, and we are finding this to be true and a best practice throughout the pandemic. Tribes continue to respond to protect their tribal members, at times in ways different than states where they are located. Most tribes are developing their own protocols when it comes to masking, testing, vaccination, and social distancing. Some success stories include the Blackfeet Nation vaccinating 95% of its population. Tribes and urban Indian organizations are also vaccinating non-tribal members, demonstrating the critical role they play in the US healthcare system. Many tribes and urban Indian organizations are working closely with their local public health departments to coordinate testing and vaccination clinics. This graph illustrates the disproportionate impact of COVID-19 on the American Indian Alaska Native population, as indicated by the solid yellow line. Many of our American Indians, Alaska Native communities have suffered tremendous losses. It is also important to note that COVID-19 is impacting younger American Indians, Alaska Native people, which speaks to the importance of protecting staff and visitors to long-term support facilities, or people generally thought of as low risk. Despite changes in national and state guidelines about masking mandates, we still need to be vigilant about protecting our American Indian, Alaska Native elders and those who love them, recognizing our elders are our wisdom keepers. They are teachers of tribal languages, songs, and cultural traditions. So in February, the Indian Health Service announced its four-pronged approach to address COVID-19, which was presented by Dr. Loretta Christensen, the IHS Chief Medical Officer, during the IHS All Tribal and Urban Indian Organization Leaders Call. And again, this took place on February 3rd of this year. And the approach covers these four strategies: prevent, detect, treat, and recover. I'm just going to cover them briefly. I think they're really important to be aware of as we're thinking about continuing to practice good prevention measures, even though we think that COVID may be on the decline. So the first strategy is prevent, which includes getting vaccinated, wearing a mask, practicing social distancing, and hand washing, which is really important. The second is about detection, and it's about ongoing testing to identify disease and transmission rates. The third is treatment. We are fortunate that there are some treatments available for COVID-19, which are described here, and they should be discussed with a medical provider. And then the final one, recover, is about addressing the trauma associated with COVID-19 and monitoring the health of those still living with the physical effects of long COVID or post-COVID symptoms. So again, these are the Indian Health Service 4 strategies going forward as a continuing effort to address issues surrounding the pandemic. Now let's talk a little bit about the data and what's happening now as of February 2022. Cases continue to spike unpredictably due to variants, and research has shown that vaccines prevent hospitalizations and deaths, and that the benefits of vaccination outweigh the risks. This graph illustrates the increased cases due to COVID-19 variants. We can see increases in daily cases attributed to the Delta variant in late 2020 and early 2021, and a very large spike attributed to the Omicron variant in late 2021 and early 2022. You can see that large spike there at the end of the graph. The most current data on vaccinations from the CDC show that 95% of individuals aged 65 years or older have received at least one dose of vaccine. This percentage does decrease to 88% for full vaccination, which is defined by having received 2 doses on different days of the 2-dose mRNA series, or having received 1 dose of a single-dose vaccine. For those 65 years and older, 66% have been fully vaccinated with a booster. To further illustrate this point about the effectiveness of vaccines, and the chart at the top left, or excuse me, at the top shows COVID-19 cases in reporting nursing homes in the US, and the lower chart shows COVID-19 deaths in nursing homes over the same period of time. I'm sorry, the top graph is showing vaccination rates, and the lower graph shows the death rates. So again, even though there was a spike in cases in January 2022, there was not a corresponding spike in the number of deaths. It was much lower. Overall, over 87% of residents in nursing homes have been vaccinated to date, according to the CDC, and this chart shows the increase in the percentage of residents with complete vaccinations and with an additional booster since October 2021. So it's up to 70%. So let's turn now to talking about what has been successful in tribal long-term care facilities. And these are some successes that were shared by representatives from 4 tribal long-term care facilities and how they supported the spiritual and emotional health of clients while maintaining social distancing. So they did things like having window visits with family, small groups, activities outside, having smaller settings in which to have a meal, helping residents have video chats with family members, creating opportunities for entertainment outside when the weather was nice, increased in-room activities. So again, practicing that social distancing and reducing large groupings of people, going live on Facebook and hosting garden parties. Some successful efforts for supporting facilities staff included increased transparency about sharing information about COVID-19 as it is learned, and updating and revising policies, reminding employees and stressing the use of employee assistant programs and the importance of taking care of oneself. Again, hosting special meals and cookouts, providing free meals, including Indian tacos, providing bonuses to staff for working through the pandemic, and this helps with staff retention. Supplying t-shirts and other items like fun pens and PPE that may be branded. And then of course, honoring in traditional ways to acknowledge their importance and the work that they're doing of taking care of our elders. And these were done through round dances or gift giving and smudging. Support for family and community, again, the importance of transparency, that open communication about what were the policies around COVID-19 in facilities. They produced how-to videos on important COVID-19 safety protocols. They did radio PSAs. They had on-call availability 24/7 to answer questions. Again, sharing meals, bringing the community together in small groups when the weather was good outside, and then virtual visits for family, and really helping residents manage technology to make those visits happen. So some lessons learned that these representatives shared included being creative and just constantly working on finding new ways of meeting the protocols around protecting residents during the pandemic, and using technology, identifying those staff that are really tech savvy that can help residents and families navigate technology, and using things like iPads and tablets, smart TVs, things like that, and how to use Facebook Live. Sounds like it was really effective. And developing partnership with the state that you're in, and making sure that you stay on top of those policies that are changing quickly, and being able to incorporate them quickly into your facility, and then communicating them out to family and the broader community. And of course, just keeping those infection control policies up to date. This is a quote from one of the representatives, Deb Arbogast, from the Medicine Wheel Village in Cheyenne River Sioux. And I think this quote is a lovely example of the strength and resiliency of tribes to respond to the pandemic, where she says, "We realized we are family for patients for each other as staff. We have bonded together to get through the COVID-19 pandemic. We have grown together as we have tried hard. So since the outbreak of the Omicron variant, the CDC has updated guidance for LTSS facilities on how to develop an infection prevention and control program that includes 6 strategies. The guidance includes managing healthcare personnel with COVID infection or exposure, strategies to mitigate healthcare personnel staffing shortages, and infection prevention and control recommendations to prevent the spread of COVID in nursing homes. The CDC emphasizes the following key points. Older adults living in congregate settings are at high risk for COVID. A strong infection prevention control program is critical to protect both residents and healthcare personnel. Infection prevention and control practices must be sustained over time, even as nursing homes resume normal practices, and must remain vigilant about preventing exposure and spread of COVID. So this is a list of these resources. And again, these resources are changing frequently. So it's important to check on them and make sure that they're matching with your policies and procedures. The CDC's dedicated page for nursing homes and long-term care facilities is shown here. It is recommended that administrators check this page on a regular basis for updates. It provides very helpful resources for a variety of toolkits, trainings, resources, checklists, and guidance pertaining to COVID-19 infection, prevention, and control. And I will cover some of these in the next few slides. CDC has updated its interim infection prevention control recommendations to prevent COVID spread in nursing homes, and these were updated as of February 2nd. Of this year. This is a list of topics the recommendations cover. An infection prevention and control program or plan should include policies and procedures addressing each of these topics, along with any of your special tribal, local, state, and other federal requirements. Your plan should also address these following elements to ensure your facility reduces exposures and spread of COVID-19. It includes providing on-site management of infection prevention and control, which includes having a dedicated full-time position or staff that oversees your infection prevention and control plan. And this person and leadership should receive regular training. The facility should be sure it has enough supplies to adhere to recommended infection prevention control practices. And this includes alcohol-based hand sanitizer with 60 to 95% alcohol, personal protective equipment, and supplies for cleaning and disinfection. Hand sanitizers should be available in resident rooms and in all common areas. Educating residents, healthcare personnel, and visitors about COVID-19 and precautionary measures that are in place and what they can do to protect themselves. So this is a really important piece of having an education plan. Again, regularly review CDC guidance for current information. Ensure staff and residents are up to date when the guidance changes. Educate and train staff about recommended practices, including reminding your staff not to report to work when they're ill. And educating residents and families through educational sessions and written materials. Also, your plan should include when to notify the health department, staff, residents, and families about outbreaks, reporting relevant data to public health authorities. So again, these are all items that should be included in your infection prevention and disease control plan. So the CDC has some really great training resources for staff on infection prevention, disease control. And so as you're thinking about a training plan, this is a really great resource to go to and have your staff take some online training. It is also recommended that a facility's infection prevention and control program include a plan for managing residents, and it clearly describes how you will manage each of these situations of when you have a confirmed or suspected infection. If a resident comes in close contact with somebody who is confirmed or suspected to have COVID-19, a plan for new admissions, readmissions, visitations, again, communications and education, and then new infections that might arise in your facility. So your plan should have very clear steps on how you're going to address each of these situations. As we talked a little bit about the lessons learned in tribal long-term support facilities, supporting the emotional health of your residents is extremely, extremely important. And this is a list of questions facilities can use to regularly assess the emotional health of their residents and help make appropriate programmatic changes as needed to support your residents' emotional health. So are there ways that you can establish a buddy system with residents? How are those residents communicating with their family members? We had talked about leveraging technology to do that, or opportunities to visit outside. How can residents connect to nature? I think that's really important. And how are they engaging in spiritual practices that support and sustain them? And then thinking about what are those cognitive and physical activities that your residents can engage them to keep them healthy, both emotionally, spiritually, and physically. So it's just as important that facilities regularly assess and support their caregiver and provider mental health. We're hearing a lot about how caregivers and providers are experiencing compassion fatigue and burnout. Please consider conducting frequent assessments of your staff. And these are some example questions you can ask. It's really important to create a culture of safety and support at your facility or with your programs. Keep communication open between staff and supervisors. Make sure staff are taking regular breaks, and be sure your staff have access to behavioral health services through employee assistant programs or through their healthcare plans. And on this slide is a number for the Disaster Distress Helpline for caregivers and providers. And I highly recommend this resource and others be posted in employee areas or distributed to staff. On the let's talk about some resources here that are also really beneficial to long-term support services. So there's the LTSS TA Center on the CMS website, which provides resources for American Indian and Alaska Native programs, including archives of these webinars. Also on the LTSS TA website, there is a dedicated page for the LTSS newsletter with the most current newsletter available and an archive of past newsletters dating back to 2014. These newsletters provide a wealth of information on the latest topics related to tribal LTSS programs. So in summary, COVID-19 has disproportionately affected the American Indian Alaska Natives in both prevalence and severity. However, American Indians, Alaska Native tribes and communities have actively responded to protect their communities and continue to do so as new variants emerge. And they're doing this in very creative and effective ways. It's important to continue implementing established preventive measures such as vaccination, social distancing, education, providing PPE, and to take the necessary steps to establish an effective infection prevention control plan or program, which is managed by a designated on-site staff person. Create a plan for managing COVID-19 among residents, visitors, and staff, and make sure that you have a communication plan associated with that so all are aware of the plan. Visit cdc.gov for updates, guidance, training tools, data, and other resources. And subscribe to the CMS LTSS newsletter to stay informed about all the latest developments, guidance, training tools, and more. That concludes our webinar today, and we will open it up to the Q&A session. Thank you.
All right, we have several questions from chat to start the Q&A section. The first is, as we reach the tail end of the pandemic, will the TA Center keep providing content, or is it only COVID focused?
Can you repeat that, David?
Sorry, is the TA Center's content COVID focused, or will it continue evolving as we move into the endemic phase of this situation?
I imagine it will continue to evolve, and it won't only be focused on COVID. There's a lot of great resources on that page that go beyond COVID.
All right, and then you mentioned something called compassion fatigue. They hadn't heard that term. I was wondering if you could talk a little bit about what it is and how it affects people, and if that's sort of what we've been dealing with.
Yeah, so we're hearing a lot out there among providers that just the toll of responding to the pandemic is really weighing on providers. And so this is an effect called compassion fatigue, where providers, they're just getting really burnt out. And we're seeing that right now, the impact that it's having on our healthcare workforce, that a lot of people unfortunately are quitting, they're leaving the healthcare field. And it's been really hard for them to maintain and sustain their response to this pandemic. So that's why we have to really think about how are we supporting our providers and staff for their emotional and physical health as this pandemic continues to stretch on.
It looks like we have a couple more in chat and a couple that came in earlier. This one is in chat. What is the best way to adopt consistent program policy for staff around COVID when guidance continues to change at CDC and we're still navigating misinformation around vaccines and masks? Yeah,
so again, it's really important to check the CDC website for long-term support facilities and their infection prevention control guidelines, and check those on a frequent basis. I would say, every couple of weeks, and just make sure that your policies and procedures, your infection prevention control plan is up to date and aligned with the CDC guidance.
All right, another question. You mentioned the need to share information about COVID-19 as it is learned and policies are revised. How do you recommend sharing that information?
Well, I think there's a lot of creative ways that facilities can come up with that information, making posters and flyers. There's electronic systems that you can send out notifications via phone calls or texts to families, so they're receiving updated communications from your facility about changes in any policies and procedures. So again, checking out the technology, how to utilize technology to send out broad communications to your community members.
All right, and then this looks to be the last one. It says, are there funding opportunities available for this?
Wow, that's a great question. I believe that there continues to be funding opportunities through legislation, and I believe Indian Health Service, if you are an IHS facility, that there may be some resources available. So yeah, I think continuing to look at CMS and see what's available in terms of that funding, I think there are out there.
Okay, and then actually there's one other question just came in about the IPC programs. As you know, there are a bunch of limited resources right now, and so if a center wants to implement those recommendations but doesn't have, say, the resources for a dedicated on-site employee, is there somewhere that they can go for guidance on how to do that?
Well, again, the CDC provides guidance. They do recognize that not all facilities are able to have a dedicated staff person, like a full-time staff person for their infection prevention control program. So that's when you make sure that your leadership is trained and aware of those guidance, and everybody in your leadership team of your facility is trained on your plan, and that you have a training program in place for that leadership and that staff. So everybody is trained on a regular basis. So my point is, it may not be one dedicated person leading this, but it really does have to be the leadership of a facility that is taking action to make sure this plan is in place, it's updated, and that all staff are being trained.
All right. One other question about visitation. Or actually, I'm sorry. There's one about, you had spoken with behavioral resources for helping elders deal with the situation. Could you talk a little bit about how that sort of emotional support ties into what has, we look at COVID as a pandemic, but there's that sort of support side, and that I was wondering if you could talk about that a little bit.
Yeah, well, I think, what we learned from some tribal facilities is recognizing the caregivers at powwows, honoring them for the work that they're doing, in the way that we do as Indian people. Gifting, I think, is really important. Acknowledging their work and the fact that they're taking care of our loved ones, I think is so important. And those opportunities to just have a meal or share food together supports the emotional health of caregivers and families and residents, of everybody. So we know how to do that as Indian peoples. We come together and we acknowledge the efforts of one another, and spend that time either recognizing people or sharing a meal.
All right, that's all the time we have for today. I would like to thank Crystal Tetrick for joining us and sharing resources to help us gain knowledge on LTSS and COVID. In closing, I'd like to remind everyone that today's webinar was recorded and that the audio and presentation slides will be made available online at cms.gov on the Tribal LTSS Technical Assistance Center website. Thank you again for joining today's webinar. Our session is now concluded.